Let's move on. What else do we look at? iPads. They're growing in popularity. We all know it. Most of us carry one. And the eClinicalTouch product on the iPad has had pretty spectacular success in terms of adoption. We got into thinking it was going to be the primary device that your nurse uses inside the practice and that you might use it outside. It's turned out differently. Many of you have written to us that you're using it extensively as your exclusive device. The form factor is changing. The expectation is changing. We need to keep investing in touch. So we'll show you some of the newer things we've done in it. We want to get a comprehensive feature list. There are, again, sessions that will cover eClinicalTouch for you. Let me log in. I have a cheat sheet here because the security guys always put complex passwords if I forget them. Those of you that are familiar with Touch, I'll give you a quick look as well. You're able to see your jelly beans at the bottom. There are colors there, as you can see now, yellow and red to indicate whether it's urgent or not. You can tap on the lab screen and see all the labs you need to review easily and quickly. That was there before. You can do your e-prescriptions as well, refill requests. You can review your documents. But let's go to the progress note for a moment. I'll open up patient Martha Curran's progress note for today. Go into her right panel. Very similar to Windows. You can see everything: asthmatic, diabetic, hypertensive, her med list. Able to see her picture. Sticky notes are there. I can see she's web-enabled as well. What have we added? We've added the same timeline that you saw on the Windows slide here as well. You do have the ability now of seeing what has happened the last 3 months, 6 months, year with the timeline. You're able to review your progress notes right from the timeline view as well. Let's go back. Billy Wood will go ahead and see his growth charts. Growth charts are there. It'll come up. Growth charts are on the Touch platform as well. Everyone in our OB/GYN practices said, we spend a lot of time in labor and delivery outside. Plus, we like the iPad form factor. Why don't you add eClinical EHR, the flow sheet, on to mobile or onto Touch as well? And we did. I'll open a patient who's here, and our entire flow sheet, OB flow sheet, is also now visible in the Touch platform. You have the ability as well to do the entire physician documentation in terms of EDD, expected due date calculations. It'll do that. You can and will be able to record and document today's visit as well. The prior visits are there. You do have the ability of doing your new visit as well. It's the full comprehensive OB side of the EHR on the Touch platform too. Now, what about dictation? What about scribe? We're doing it on desktops. You like it. It's even more appealing when you actually do it on Windows. So we recently added the capability, which will release in first quarter. Whatever is there is coming out version 10. But scribe will also be a part of eClinicalTouch, which means, and in the past we've used the speech recognition that comes native with the iOS platform. You could still use that. But we've expanded it now to include the Dragon's version of Speech Anywhere. There is a final stages of getting that incorporated. But for example, you can tap in and dictate your note just like you dictated. For example, I could say, patient came in with complaints of chest pain and shortness of breath, period. Prior history of coronary artery disease. period. Lungs, colon, clear to auscultation. New line. Extremities, colon, bilateral pitting edema. You could scribe that. When you put the click on it, it will actually put that entire note back into your progress note like you had tapped it in, and you'll be able to see it. That's touch for you. There's a lot more. Timelines, there's a way to ink. You can fill out forms. If you're giving out you need any consent, you could essentially go in and then click on your forms that you've always filled out, your consent forms, and you can tap on it. You can expand if you like to, or more importantly, leave that in a state, and you have this ability to now sign. You can zoom in, turn it on, and sign. And then when you're done, it'll become part of your patient's documents as well. So pretty cool. That's what we think. We're going to keep investing time and energy in making the iPad product line fully compatible and fully enhanced in terms of features and functions. So you know of eClinical Mobile, which is the web version, works on most smartphones. We've come out with an app that will be in the App Store right when the version 10 releases, both on iOS native and Android native. It's going to have some new capabilities that the web version doesn't support. But before I do that, let me go in. The gentleman here with the Jip cam needs me to put it in a way that he can record it. Tap into eClinical Mobile. I will log in. I have the ability to see my schedule for the day. I can go to a month view, and if there's a dot on any of the dates, that means I have patients on that day, and go back to my day view. You have the ability to look at phone messages. I have one. I can respond to that by tapping it on it, reading, and then reassigning it to a staff member. Go back again. I have 4 labs, at least one abnormal that I need to review. I can tap in and look at the CBC. Again, put my notes in, reassign it to a staff member. There's more. There's charge capture with rounding lists. You can set up your predefined defaults, make it easier and faster for you to select templates for charge capture as well, and messaging. But there's one really cool feature. You can stay logged into mobile even when you're in the practice. You have your patients that are here, that are coming to see you today. You have the ability of selecting that patient. So what do you see that is different on Warren's Taft schedule? You see a camera. What does the camera allow you to do? Take a picture. What do you do with the picture? You take it, you put it on Facebook. No, I won't. Not that picture. Use photo. Image uploaded successfully. And where will it show up? Where will it show up? That's pretty cool. That's pretty cool. That's cloud computing at its best. Mobile, speaking to some data center somewhere. Your EHR can be anywhere, in your office's servers, in your hospital servers, or sitting in the eClinicalWorks cloud. This capability works. As we said, we're not trying to make one any better than the other.